I love the heart of eye care because our heart is really in what we do. We have been in business for over 3 decades, and it has been an amazing journey. We have seen families go through very challenging situations, and we've partnered right along with them in those situations in every single decade we've been in business. And so in 1993, I said, I care. I really care about restoring excellence in healthcare, and that is what eye care stands for. When I talk to some of our nurses and caregivers, they say, you understand what we do, and you're not willing to put us in any situation that you're not willing to go into yourself. We don't ever want to be obsolete. You know, sometimes we get into, I don't want to talk about any particular industry, but we know that some industries you get into it, you name it one thing, and then, oh my gosh, we got to turn it around because that situation is obsolete. We don't want to do that. We're always, and that's why we keep a multi-generational staff, team, and family, because while our mission was to care about restoring excellence in healthcare, it looks different in every generation.
A lot of healthcare companies are not available on weekends, not available on holidays. We're literally 24/7. We don't hide from the phone, from an issue, from whatever the situation may be. We're there. And we like to meet most of our clients in person as well. So we like that one-on-one, that personal touch, feel, to know that we want them to put a face with the business, a face with our name.
Not only do we genuinely take care of our clients, but we take care of our team. And I often say to our team, even the interview process, and that's why we have an amazing team, is you really can't say I care if you don't. In the Washington Post, and there was a Mercer research study in 2018 that said that by the year 2025, there would be a shortage of about 430,000 caregivers. That means that there will be people who need care, but not enough caregivers. And so with that, you get a lot of people that get into the industry. But I really believe that when people find out that we're family owned and operated, that I'm willing to go out with you to walk you through whatever you're going through with a client, that you don't have to. Tony talked about hiding, because we don't hide from the phones. We tell the caregivers, don't hide. We'll walk through with you. We've been through it and we understand, and you can talk to us.
And we have an extensive vetting process that we go through. We want to make sure that we match the family's needs to the caregiver's capabilities and their experience and their knowledge. And so we have an extensive vetting process that we go through to make sure that it's a good fit for them. And that's the reason I think that we have such longevity, not only with our clients, but also with our caregivers, because we invest in them so that they now in turn can invest in the family that they're working with. And they really become a part of the family, really know that there are likes and dislikes. And I think that it also increases the level of care, the quality of care that we're providing.
And so the people that I vet, I'm willing to send them to my own family.
That's right.
And that's exactly what I did. It was really right after that we expanded and added the nursing and personal care assistants, because we said, this is needed. Mm-hmm. You know, while we can do intermittent care, we want to be in there and really to change lives for the better.
We are a healthcare company that takes care of you regardless of your condition. No matter how dire it may be. We have help from hospice patients we've taken care of, infants, youth. No matter what's going on in their lives, we want to be there to help them at their most difficult times in their lives. And that's the reason I think that they trust eye care, because we really do care. For a family member that's remote, don't live in this area, for example, they want a peace of mind to know that mom and dad, or my spouse, or my grandparents are being well cared for, just as if I would care for them if I was there. So even though they may live in a different state and they may not make it back as often as they would like to, or for some other reasons they can't, we're that extended family. we become their eyes and their ears. Healthcare is entrenched in our family. 2 of our 3 children are in healthcare right now.
Absolutely.
And these little ones may be as well one day. So it's wonderful to be able to pass on the legacy because healthcare is going to be needed indefinitely. All of us at some point is going to need some form of healthcare. So it's good to be able to have a generation that we can pass this on to.